One of the most useful tools here at Jefferson Animal Hospital is the ultrasound. This is Dr. Kennedy and also Dr. Isherwood and Marissa, and of course Max, our furry friend who's doing so well. Explain what that is and how to use it.
So ultrasound is one of the best diagnostic tools we have in veterinary medicine. It's basically sound waves that bounce off the liver, the kidney, the gallbladder, the heart, and it gives you images. Everybody knows about ultrasound if they've been pregnant or because it's what they commonly use to check your baby status. They commonly use it also to check for clots in your jugular vein, and they'll do scans. But ultrasound is widely used in human medicine. But if we take an x-ray of a pet's abdomen and we see something that looks like a tumor, we'd have to go in and do an exploratory to see what it was. By using ultrasound, we can go in and we can look at it with the ultrasound in the abdomen. Then we can take ultrasound-guided biopsy samples, and we don't have to put the pet necessarily under general anesthesia or do a full exploratory. It's an extremely useful tool.
How important is it to have someone like Dr. Isherwood who's, adept and very skilled?
Dr. Isherwood's very skilled. He's studied a long time, and he's become very skilled at it. It does require a lot of study to get that hand action to be able to see what you're trying to see with the ultrasound probe. But we will routinely, all my doctors can use the ultrasound equipment, but Dr. Isherwood's at a little higher level of the diagnostic skills. If we get a pet that comes in hit by a car, we can put the ultrasound probe on to see if there's fluid in the abdomen, which might mean that it's bleeding in the abdomen. If we have a pet come in that has, the x-ray shows it might have an intestinal blockage, we can use ultrasound to determine, do we really need to go to surgery? Is it a real blockage or not? If we have a pet that we think has bladder stones that can't urinate and the x-ray doesn't show anything, we can use ultrasound to see if there's stones in there that just don't show up on the ultrasound. Pets that come in with cardiac disease, the ultrasound, it'll show if the chambers are enlarged. It'll show if the wall of the heart chamber is enlarged. It'll show if the valves are abnormal. It can tell us whether it's a potentially not a heart problem, maybe it's really a lung problem, pulmonary problem. So it's non-invasive. Max is not sedated. He's just calmly sitting here. Yeah, and most pets, when you do this, it's once we get them into a lateral position like this, they're not scared and they don't need to be sedated. So it's a tremendous diagnostic tool to be able to find things that would otherwise potentially require surgery or might require euthanasia because we can't give the clients any answers.
Dr. Isherwood, I have to ask, how does Max look?
Max's heart looks really good, so no underlying heart disease on our buddy Max.
That's wonderful
And
to
we've
know.
already peeked at his belly side, so his abdomen is good also.
Okay, and so
And
the
one happy client.
one happy client, one happy mama as well. The only thing you have to do to the dog is shave.
Shave.
And that's it.
We shave an area, we shave an abdomen, or we shaved usually the right side of the chest, and then and a little
And
gel.
a little gel.
Yeah. We've got Max up on a little platform so we can get the ultrasound probe up under his chest to be able to see the heart movements. As far as the abdomen, they just need to be laying on an exam table, put a little gel on there, and we can go in, but it's a very common, well-used tool.
Well, tell me this, if you're just going in for routine care and you just want to know, is that something that you can actually have done for your animal?
Unless the pet's symptomatic, we wouldn't routinely
there's no
do
reason
ultrasound.
then. Okay.
No, not usually. Now, if we pick up a heart murmur, we might request Dr. Isherwood come in and do a cardiac ultrasound, which is called an echo. But if we are doing a routine exam and the pet's coming in for vaccines, and we palpate that abdomen and feel something, feel a mass, then we're going to tell the owner, I really would like to get an x-ray and potentially, depending on what the x-ray shows, potentially an ultrasound of the abdomen to give us more information to see where we are.
Okay, fantastic. Well, Max, I think you deserve all the treats, that's for sure. From Jefferson Animal Hospital with Marissa, Max, Dr. Isherwood, and Dr. Kennedy, I'm Angie Fenton.